Bismillahirrahmanirrahim. Test for the preparation of medical officer including the MO, WMO, ppsc, BHU. The basic हमारे पास जो क्वेश्चन होंगे, पहला फर्स्ट स्टेप हमारे पास ऑल ऑफ द फॉलोइंग आर द ट्रू इन रिस्पेक्ट टू द Zillinger Elysian syndrome except pancreatic gastronemas are the most common in the head of the pancreas. Second option पे है solitary primary tumors are very common. Duodenum, hilum of the spleen and rarely the stomach may have the gastronemas. Majority of the tumors are biological malignant. The correct option is solitary primary tumors are very common. This is the option which not relating to the Zillinger syndrome, but all other options are in relative to the Zillinger syndrome. The second option is the most valuable provocative test for the Zillinger syndrome. Feeding of the standard meal, calcium infusion test, secretin injection test, histamine injection test. The correct option is for Zillinger syndrome. Identification is the secretin injection test. The test through which we can provocative test है हमारे पास जो Zillinger syndrome को identify करता है. The third question is the Zillinger syndrome is reported in association with all of the following except medullary carcinoma of the thyroid, hyperparathyroidism, pheochromocytomas, pituitary adenomas. The correct option is medullary carcinoma of the thyroid. The question number 4. Zillinger syndrome is associated with all of the following except recalcitrant of upper GI ulcers, diarrhea and steatorrhea, vitamin B12 metabolism. The correct option is the diarrhea and the steatorrhea. The next question is the Zillinger syndrome is associated with all of the following. The next question is question number 5. The commonest malignant tumor of the gallbladder is adenocarcinoma. Squamous cell carcinoma is A option. B option is the adenocarcinoma, hemangioendothelioma, and the delta option is the sarcoma. The correct one is question number 5 ka B option is the adenocarcinoma, which is the commonest malignant tumor of the gallbladder. The next question is the cholangiocarcinoma may be associated with number option A is the cholelithiasis, option B is the ulcerative colitis, number option C is the tinea, echinococcus infestation, number option delta is the biliary atresia. The correct option ulcerative colitis, cholangiocarcinoma may be associated with ulcerative colitis. The next question is the RHC syndrome may be associated with all of the following. Option A is the moderate jaundice, option B is the elevated aminotransferases, option C is the hypoglycemia, option D is the chickenpox as the option D is the chickenpox as precipitating factor. The correct option is the moderate jaundice. Moderate jaundice is associated in case of the RHC syndrome. Question number 8. Clinically, severity of the mitral stenosis is best assessed by option A is the diastolic shock, option B is the proximity of the S2 opening snap gap, option C is the paroxysmal nocturnal dyspnea, option D is the shorter duration of the mid-diastolic murmur. The correct option is the B. Proximity of the S2 opening snap gap, it is associated. So the mitral stenosis is clinically best assessed by the proximity of S2 opening snap gap is the correct option. Question number 9. Opening snap is low pitched, option A. The option B is the best heard with the bell of the stethoscope, option C is the best heard in the standing position, the option delta is or the D option is present in the late diastole. The correct option is the best heard in the standing position in the in case of opening snap. Question number 10. Hemoptysis may be found in number option A is the left ventricular failure, option B is the right ventricular failure, option C is the pulmonary stenosis, option D is the left to right shunt. The correct option in the case of hemoptysis may be found in case of left ventricular failure. Next question, question number 11, which is not included in the lipid tetrads in risk factor for the coronary heart disease? Option A is the increased VLDL. Option B is the decrease. Option B is the decrease HDL. Option C is the increase in the small dense LDL, and option D is the increase in the concentration of the lipoprotein. The correct option is option A. The correct option is answer A, increase VLDL concentration. Sorry for that, the question number 12, the statement is missing right in this slide. I am reading the slide. Regarding the ischemic heart disease in the India, which of the following is not true? Option A is the high incidence of insulin resistance. Option B is the prevalence of the CAD is more in the India in comparison to developed countries. Option C is the occur as in the decade earlier. Option D is the high LDL in the Indian population. The correct option is the high LDL Indian population. Question number 13, bilateral pleural effusion is the commonly seen in case of option number A is the SLE, option B is the nephrotic syndrome, option C is the pulmonary tuberculosis, option D is the congestive cardiac failure. The correct option is the bilateral pleural effusion is most commonly seen in case of systemic lupus erythematosus or SLE. Question number 14. Question number 14, Levy Bond's angle is approximately 120 degree. Option B is the 140 degree. Option C is the 160 degree. Option D is the 175 degree. The correct option is the 160 degree. Question number 15, hemorrhagic pleural effusion may be seen in option number A, cirrhosis of the liver. Option B is the pulmonary tuberculosis. Option C is the SLE. Option D is the delta D. Option D is the myxedema. The correct one is the pulmonary tuberculosis is the case in case of the hemorrhagic pleural effusion may be occur. The question number 16, in the monoplegia, usually the site of lesion lies in option A is the pons, option B is the internal capsule, option C is the cortex, option D is the midbrain. The correct one option is the cortex. In the monoplegia, the site of lesion lies in the cortex. Question number 17, the leak sign is present in option A is the cervical spondylosis, option B is the prolapsed intervertebral disc, option C the Duchenne myopathy, option D is the Guillain-Barré syndrome. The correct one option is the prolapsed intervertebral disc. Question number 18. Commonest cerebrovascular accident is seen in option A is the cerebral hemorrhage, option B is the cerebral thrombosis, option C is the cerebral embolism, option D is the subarachnoid hemorrhage. The correct option is the cerebral thrombosis. Question number 19, all are the features of the pontine hemorrhage except option number A is the disconjugate gas, option B is the pinpoint pupil, option C is the hypothermia, and the option D is the paralysis. The correct one is the hypothermia. Question number 20, all of the following are the sources of cerebral embolism except option A is the tricuspid incompetence with the occasional ectopics, option B is the left ventricular aneurysm, option C is the left atrial myxoma, option D is the subacute bacterial endocarditis. The correct one is the tricuspid incompetence with the occasional ectopics. Question number 21, all of the following produce meningism except option A is the Wheels disease, option B is the cerebral malaria, option C is the atypical pneumonia, option D is the enteric fever. The correct option is the cerebral malaria that produces the meningism. Question number 22, fruity odor in the urine is found. Option A is the urinary tract infection, option B is the diabetic ketoacidosis, option C is the alkaptonuria, option D is the chyluria. The correct option is the diabetic ketoacidosis. Question number 23, most beneficial drug in enuresis is option A is the fluoxetine, option B is the haloperidol, option C is the chlorpheniramine, option C is trimipramine. The correct option is trimipramine. The question number 24, the urinary clearance of the IgG compared with the transferrin is found to be less than 10 in option number A membranous nephropathy. Option B is the minimal lesion nephropathy. Option C is the focal glomerulosclerosis. Option D is the mesangial proliferative nephropathy. The correct option is the minimal lesion nephropathy. Question number 25. Which of the following is not a criteria for the diagnosis of nephrotic syndrome? Option A is the hypertension. Option B is the massive proteinuria. Option C is the hyperlipidemia. Option D is the answer. The correct option is the hypertension. The hypertension is not a criteria for the diagnosis of nephrotic syndrome, but all our other options are. Question number 26 is the oliguria is labeled as option number A, the when urine is less than 50 ml urine per 24 hour. Option B is the when less than 100 ml urine per 24 hour. Option C is the less than 200 ml urine per 24 hour. Option D is the 400 ml urine per 24 hour. The correct one is the less than, when there is a less than 400 ml of the urine per 24 hour, it could be a oliguria. Question number 27. The fatty cast is often diagnostic of. Option A is the nephrotic syndrome. Option B is the acute glomerulonephritis. Question number 28. Which of the following is not a cause of the sterile pyonuria syndrome? Option A is the encephalopathy. Option B is the myelopathy. Option C is the neuropathy. Option D is the myopathy. The correct one option is the myelopathy. All are other options are involved in the case of the sterile pyuria, but myelopathy is not in case of the sterile pyuria. Number 29. Transient deafness is most commonly associated with ethachloronic acid, spironolactone, hydrochlorothiazide. Option D is the bumetanide. The correct option is the ethachloronic acid. In case of the transient, in case of the transient deafness, most commonly associated. The question number 30. The urine is obligatory diuresis following the relief of the urinary obstruction. The question number is concentrated. Option B is the low in the sodium. Option C is the dilute and alkaline. Option D is the highly acidic. The correct option is the dilute and the alkaline. Question number 31. Blood level of all rises in acute renal failure except option number A is the uric acid, option B is the potassium, option C is the sodium, option D is the creatinine. Blood level of all rises in case of the acute renal failure, sodium. The correct option is the sodium. Question number 32. Which of the following is not added to the urine by the tubular secretion? Option A is the potassium, option B is the urea, option C is the hydrogen, option D is the creatinine. The correct option is the urea. The question number 33. Gum bleeding is the characteristics of all of the following, all except option number A is the chronic phenytoin therapy, option B is the aplastic anemia, option C is the scurvy, option D is the hemophilia. The gum bleeding, all of the following characteristic सब में होती है इन केस ऑफ क्रोनिक फेनाटाइन थेरापी. इसके अलावा बाकी सब में गम ब्लीडिंग हो सकती है. The question number 34. Which of the following is not true in the thrombocythemia? Option number A is the prolonged bleeding time. Option number B is the normal platelet count. Option C is the platelet aggregation defect. Option C is the prolonged clotting time. The correct option is the prolonged clotting time. The question number 35. Which of the following is not found in the eosinophilic granuloma? Option number A is the eosinophilia. Option B is the osteolytic lesion in the bones. Option C is the affection in the adults. Option D is the absence of the systolic manifestations. The correct option is the eosinophilia. Question number 36. Circulating anticoagulants are found in option A is the hairy cell leukemia, option B is the SLE, option C is the multiple myeloma, option D is the dermatomyositis. The correct option is the circulating anticoagulants are found in SLE. systemic lupus erythematosus. The question number 37, which of the following is not true in the thrombotic thrombocytopenic purpura? Option A is the uh, fluctuating consciousness, Combs negative hemolysis. Option C is the fragmented platelets. Option D is the early development of the acute failure. The correct option is the C, fragmented platelets. Question number 38, which of the following is not recognized as the nicotinic effect of the organophosphoric poisoning? Option number A is the fasciculation, option B is the flaccid paralysis, option C is the lacrimation, option D is the muscular twitching. The correct option is the lacrimation, which is not recognized as a nicotinic effect of organophosphorus poisoning, but all other options can be recognized. The question number 39, IV ethanol therapy is the treatment of choice in the poisoning with the option number A is the formaldehyde, option B is the methyl alcohol, option C is the glycol, option D is the isopropyl alcohol. The correct option is the methyl alcohol. सो मिथाइल अल्कोहल की पॉइजनिंग में हमारे पास IV इथेनॉल थेरापी इज द ट्रीटमेंट ऑप्शन होगा. Question number 40, drowning feature of all of the following except option A is the 10 to 20% cases are dry drowning. Option B is the hypoxia is the most important problem in near drowning. Option C is the DIC may occur in as a complication. Option D is the metabolic alkalosis is in established complication. The most probably the correct option is the metabolic alkalosis is in established complication. The question number 41, drug of choice in paracetamol poisoning. Option A is the penicillinamine, option B is the amyl nitrate, option C is the N-acetylcysteine, option D is the cholestyramine. The correct option is the N-acetylcysteine. So this was the half of the question paper MCQs, and the half of the next topic we'll discuss in the next video. So दुआ में याद रखिएगा. Thank you so much. जज़ाकल्लाह.